Hi, I'm Dr. Leila, a California board-certified family and cosmetic dentist and the proud owner of Leila Hariri Clinic in Dubai. I graduated from UCSF, one of the top 5 dental schools in the world, and bring over 25 years of experience, 21 of them right here in Dubai. I've been honored with the I Love My Dentist Award twice, thanks to the trust and connection I share with my patients. My mission is to transform smiles, building lasting relationships, and make dental care something you can feel confident about. Join me as I share expert advice, stories, and insights to help you achieve the healthy, beautiful smile you deserve. Welcome back to Ask Dr. Leila. Today is a very special episode because we're introducing a new member of our LH Clinic family, Yasmeen Arafsha. Her career has been marked by her dedication to improving smiles and empowering patients. She's even won the prestigious Best Dental Hygiene Case Award from CAP. Join me as we learn more about Yasmeen's journey and her expertise. Let's dive right in.
Thank you so much for having me. It's a pleasure being part of the clinic and happy to be on the podcast.
Lovely to have you, beautiful Yasmeen. Can you give us a little more info about your background and how you became a dental hygienist?
Oh, I think the specialty chose me rather than me choosing it. So let me keep the story a little bit short. So basically, I was 0.02 grades away from going into medical school. And going into applied medical school, my plan was to, okay, I'm gonna get great, grades and switch to medical school. But the funny thing, when we had the introductory about dental hygiene as one of the specialities under allied medical health, I was just blown away by the diversity of this job and how you can communicate with patients, communicate with professionals, create this lovely balance of preventive dental care and at the same time, periodontal care. So as a person who likes to wear many hats, you can say, I just felt so alive thinking of becoming a dental hygienist and working in so many different fields that all fall into one place, improving general health, starting with a healthy smile.
Beautiful. And it's
Thank
so
you.
true. It starts with the health of the mouth.
Absolutely.
As we know more and more about how the mouth is related to the full body. So you've been doing this for how long now?
Oh, I can't believe it, but 15 years in February
And you're originally from?
from Saudi. So,
Okay.
yeah, born and raised there.
So give us a little background from Saudi, where you were working.
Oh, God. So basically, I started my career in private dental practice, which was quite an elite practice. For someone who is a new graduate, it was like a huge privilege starting there. And then after that, I feel like all my dreams came true starting to work in King Faisal Specialist Hospital. So this hospital is oriented for special needs care and very critical medical conditions. I've learned so much on my journey there, met a lot of amazing people, patient-wise and also professionals. And that was a place that kept humbling me year after year because it was a daily learning experience.
Beautiful.
Yeah.
Beautiful. I know you're part of the Hope Initiative. If you want to just
Yes. Oh, God.
give us just a quick brief.
Of course. So the Hope Initiative was something I started on my 5th year there. The whole idea is I get bored very quickly and not in the bad sense. I always feel the need to do something extra year after year. And the Hope is short for Hospital Oral Health Patient Education. What we started noticing is that we get a lot of clearance patients, which are patients who are going for major surgeries, for chemotherapy, radiotherapy. And unfortunately, the last thing that would, be placed in order for them to be cleared was dental. It was there. It was part of the whole program of getting them better. But the patient did not understand, like, okay, well, I'm this sick. Why should I bother by doing a cleaning? Or why should I bother by, fixing my teeth? And the idea behind the Hope Initiative is to go directly to them in their rooms when they start their hospitalization journey and to start explaining how to take better care of the mouth, how it's connected to their overall health. For them to understand, for example, if they are going through chemotherapy or radiotherapy, that this might have side effects, but we can get through. And the
Bravo.
biggest message is from the short name, Hope. It's giving them hope that they can lead a healthy lifestyle with taking better care. So it wasn't just about brushing and flossing and using a certain mouthwash. It was about being able to eat normally, being able to smile, being able to even talk normally without having all of these side effects from, whatever medication they are going through.
It's such a beautiful initiative, honestly, for you to be part of. And I feel so privileged, knowing you, knowing someone that is as part of this.
Thank you.
And on another note, winning the Best Case Dental Hygiene Award in CAP, as my patients know all about CAP. How does that feel? That's really prestigious.
I mean, I'm happy to be within the CAP family over here.
Yes.
Everything happened by chance. I wanted to feel, again, revived. I wanted to revive what we were doing when it comes to preventive care. And the crazy thing is, my case was a little bit different than what is presented usually. So usually they would present a case of a before and after, and how with the hygiene care you would improve a smile. I chose to actually dive through the Hope Project and research I've done there in King Faisal Hospital with my amazing colleagues that mainly try to understand the level of oral health care for head and neck cancer patients before starting the treatment, so we can put a proper protocol. And that journey led us into expanding the Hope Project. And then afterwards, even gave me the opportunity to visit other hospitals outside Saudi Arabia and to implement the same concept. Healthy smiles create a healthy body. And the fact that I actually won that award was honestly a great privilege.
It's a testament to your passion, honestly.
Absolutely.
We see your passion in hygiene.
It's a drive to tell me that, you're on the right pathway. Keep going.
Lovely, Yasmeen. Can you share a memorable moment with us that impacted you in your career?
Where to start? I think shifting from Saudi to the UAE was like something I will never forget. Honestly, it took me out of my comfort zone completely. And for some reason, people always have a special definition for home. But I was very lucky to be surrounded with people that helped me, mold whatever, new career pathway I wanted to move into. And coming to the UAE is definitely life-changing for me. And this is something I will never forget, because the first year here, I've done my first introductory course for ITOP students. I've done my first visit to Ajman University. I've done my first ever CAP lecture, which is a dream come true as well, for the dental hygiene seminar. And I was privileged to see patients, that I would never have expected to have on my chair. And that trust alone, helps me again remember that, okay, there's always something new to learn.
100%. And in fact, I was attending CAP this year, and then in the biological dentistry section of that, you were the chair all day, correct?
I know. I still can't believe it.
I know. That's amazing.
These experiences are very humbling, but they are, one of the best things that I gotten, privileged to experience here in the UAE.
That's lovely. And as an ITOP instructor, can you give us a bit more for our audience what that exactly is?
ITOP is the true love for any preventive, care specialists. So ITOP is short for individually trained oral prevention. And basically, some people see it from the outside as spending 4 days teaching how to brush and floss. But it goes beyond that. It goes beyond the idea of just brushing, flossing, or whatever tools are used in the clinic. We dive deep into the psychology behind oral health care, behavior management, changing behaviors, changing habits, which is a huge hassle for some people who are outside of the dental experience.
Correct.
So with ITOP, we go through every single tool, focusing on 3 criteria: making it acceptable, effective, and atraumatic.
Okay.
Whether it is using the floss, the interdental brushes, which I love, or a manual or electric toothbrush. We also dive into the concept of whether to use chemotherapeutics, which are the toothpaste and mouthwashes. And again, because you
Beautiful.
mentioned being a biodentist, going into this bio life,
Yes.
definitely the whole concept of using these simple aids rather than going into those complicated chemotherapeutics fits in the whole circle.
That's amazing. So you actually teach hygienists in this region on all these protocols.
Hygienists, and believe it or not, even like majorly specialized consultants. Last year, we had a professor in periodontology and a lecturer in orthodontics. And honestly, the way they perceive all of this information, especially when we go into the hands, touch to teach part, and you feel that these are people who appreciate those preventive things. As one of the professors, Prof. Mario, he's a hygienist/psychologist, puts it, whenever you buy a very expensive car, so for example, implants, when you put an implant, you want to make sure that you have the right maintenance. And that's what iTop usually provides for every professional that goes through it. And that's my favorite part of empowering dental hygienists, to tell them that you are, that beautiful maintenance system, to make sure that this whole system of dental work, the dental family, works synchronized and flawlessly.
Yes, maintenance is key. But in what we do, definitely maintenance is key.
Absolutely.
So what's one piece of advice you can give to your patients that you always love to give to your patients, I would say?
I go through this trio: make everything in life acceptable, atraumatic, and effective. It works for the dental hygiene care, but it also works in all aspects of life. And I've learned this from my psychologist as well, which I'm always proud to admit. Hydration is key. So
Hydration.
I know it's a little bit, it feels a little bit outside of the dental scope, but definitely hydration. And we're not talking about hydration just drinking water. We're talking about hydration of body and soul. A little bit of a philosophical approach, but we're talking about hydrating your body, hydrating your mind, hydrating your soul. And each person has their own unique way to do that.
100%. Or they're in the trials of life.
Exactly.
I've overheard you tell patients consistency is key as well.
Oh, yeah, definitely. With consistency, you make sure you have a protocol that you can follow every day. Make it simple so that it doesn't become a hassle. But also know that even if things fall apart at some point, you can always just
gather the parts and start again.
Exactly.
No, as humans, we need consistency. We need routine. Maybe the routine is the word. So outside of work, lovely Yasmeen, what are some of your hobbies and interests?
How much time do you have? Okay. Two main things I always love to mention is horsemanship and music. So these things have, in the past 4 or 5 years, have molded me into the person I'm hoping to become. When it comes to horsemanship, I'm a very proud owner of a mare called Gypsy. I've learned so much from her: patience, resilience, consistency. And it breaks my heart that she's back home, but she's being spoiled very well, like any kid.
Where's home?
In Saudi, in Jeddah.
Oh, okay, okay.
Yeah.
Yes.
She's been, there. She's been with me for the past 4 years. She's turning 14 in March.
Wow, mashallah.
Which is almost 40 in,
in human years.
Human years.
Yes.
Which means that I'm going to start learning from her more than,
So
I
she's
teach
going
her.
through midlife crisis right
I
now.
hope not. I hope not. I mean, I know that she gives me a look every time I come to visit, but she's very forgiving, which is something you can learn a lot from horses. The fact that kindness is reciprocated and forgiving is the best way of life.
Beautiful.
And like one of the things that
Truly, when we forgive, we are relieved ourselves.
Absolutely,
Yes.
absolutely. And believe me, like I think animals teach that in the best way, with all respect to humans, of course. And with that, like, going into the equestrian world, I've learned to even deal with special needs, people in a much better way. Because again, horses have a very beautiful understanding of how to treat people in a unique way. When you are true to them, they are true to you. And again, like you cannot talk about horses and not mention that clicking sound they make with their hoofs. And I think
That's music.
that's music. That's music to my ears. And I think one of the things that makes me, connect music to horse riding to dentistry as well. Yeah, music is something new in my life. That's the thing.
No, music is your closest friend because whenever we're alone, we always have music to tune into. At least
Beautifully
that's how I
said.
feel because
Beautifully said.
I've played piano and
Oh,
there's
nice.
times where if I start playing piano, I need that me time.
Wow,
So it's
beautiful.
gorgeous.
Beautiful.
I hope to meet Gypsy one day,
I
by
hope
the
so
way. I
too.
really
I
want
hope
to
so
meet your
too.
lovely horse. Can you share a memorable story from your career that had a big impact on you?
Hugest impact. I'm gonna go a little bit backwards to uni years. So I remember my first patient from the special needs category was my first patient to do a full report on. Abdullah, I still remember him up to this day. He was a kid with Down syndrome. And the fact that we were able to play in the clinic, sing, and especially in a very conservative environment, and having that, become a very contagious thing. Everybody in the clinic started singing and playing just to have Abdullah, sit on the chair and feel like royalty. That I will never forget, and I love that I remember up to this moment that when I graduated, his mom was still in touch. We get in touch with our patients, up to the last second, and she was very impressed how her kid was actually excited to come to the dental clinic at some point. Excited maybe is a big word, but at least he became very much aware that this is a safe zone. So that's definitely something I'm gonna hold close to my heart.
And we try to create that for all our patients,
Absolutely.
all ages.
Absolutely.
But if you can do that with someone like Abdullah, then definitely you have the talent to do this for
I hope
all
so.
the patients.
I hope so.
And what's next for you in the journey with LH?
So again, getting to know the clinic and everybody here, getting to know you, Dr. Leila, makes me very happy to be part of a team that I feel I belong to. I'm hoping to build some roots here. I'm loving every single detail that I get to learn from the patient that revive this point that we're not just dealing with the mouth, we're dealing with the whole person. And yeah, I'm hoping this hygiene speciality grows into something bigger, something that touches the whole community.
I'm sure it will, lovely Yasmeen. With your expertise and talent, you are definitely an asset to LH. Again, thank you for being here.
Thank you.
And if you haven't made your appointment with lovely Yasmeen, please do so today so you can see her passion. And until next time, have a lovely week, everybody.